Good morning. This is Wendy Johnstone from Family Caregivers of BC. I just had a moment where I didn't know if it was Tuesday or Thursday, but it's Thursday morning. I'm not sure where you are at in British Columbia, but up here in the Comox Valley, we are starting to get some crazy winds. So my dog is pacing around the house and whining. So I do apologize if you hear some whining from our anxious dog. So today we are going to talk about accessing community resources, and I'm thrilled that you are here to join us live. And if you're watching this after the fact, welcome, and hope you find it helpful. So accessing community resources is a very big, broad theme. And I think, sometimes the greatest challenges is that there's not one route to take, or there's always not just, kind of one place that you can go and start your research. So today we're going to talk a little bit more about the process, and then we are also going to talk about some really good resources that you can tap into. So I want to start off first by talking about this idea that family caregiving or caregiving, it's really unique to our situation and to us. And we all have different supports and resources. We also have different needs and wants as caregivers. And so how we access those resources are going to be really dependent on where we're at on a very personal level. And so one of the things that I really like to use is we have a caregiver personal planning tool, and it's a great way just to help prioritize your needs, also even get you to identify what your needs are. And what I might offer up is that sometimes talking to someone through the process or through your challenges can be really helpful, because it will help bring to light what the priorities are. And so using this tool is a great way to start that process. Sometimes we like to do it on our own. Other times we like to engage, whether it's a trusted family friend or trusted source. And then thirdly, you're always welcome to call the caregiver support line, and our team will support you through helping you to identify and prioritizing your needs. So I really want to talk about that. That's often the very first step that we usually recommend, is to really, prior to starting to access community resources, is to really understand what our own personal needs and wants are, so that we can better inform our next steps. So the other really important thing about needs is that not all your needs could be related to caregiving. When we're working with family caregivers, whether it's a caregiver support line, in webinars, in podcasts, in our coaching sessions, what often strikes us is that family caregivers need different types of information for different types of needs and wants. So an example is, I was connecting with a family caregiver who's also working full-time, who's caring for what we call multiple caring responsibilities. So she's caring for a parent, but she's also caring for a sister who's had some chronic illness. And so her needs are very different, in the sense that she has some very pragmatic resources that she needs and supports. And so in this case, she needs, programs and supports through certain publicly funded services. But then she also requires some personal care, like her own self-care needs. And it's also really good to try and delineate those two different types of needs, ones that are directly related to your role as a caregiver and supporting the person you're caring for, and system navigation, and having additional supports and programs, for the caregiver, which also provides support for you, in addition to your own caregiver well-being. Sometimes there are community supports that will help support you in that regard. So before I forget, the one thing I did want to mention is that I think I'm a little biased, but our newsletter and e-news is just amazing. We pull in different writers, different perspectives. We provide some really good tangible strategies and tidbits of information, as well as links and resources to other community support. So before I forget, if you haven't signed up for the newsletter, please do. It's just it's a fantastic resource. It comes out quarterly, and then every month we have e-news. So around accessing community resources, the third area that I wanted to touch on today is that one of the things that we can do for ourselves as caregivers in, again, knowing how to access the right community resources, is to really understand the system we're dealing with. And it's very dependent on whom you're supporting and caregiving for. So for example, if you're caring for an elderly parent or a spouse that is a senior, or dealing with cognition issues, then the system you're going to deal with is going to be different than if you're caring for someone who has an acute illness, who has a chronic illness. And so knowing though that system is really important, because they are very different depending on where they fit within the larger healthcare system. I know that's really vague when I know it seems vague, but really understanding, the scope of services and support in that box related to whom you're caring for is really important. And that takes time, and sometimes that takes a little trial and error to find the right person, or to find the right way to travel through that particular system. The other thing I was going to say too is that disease-specific organizations are also a really helpful tool. So whether it's kidney disease, or whether individuals who have Parkinson's or multiple sclerosis or cancer, that often those disease-specific organizations are also a really good place to start around understanding that particular healthcare system. And then, of course, it's going to vary dependent on whether you're looking at publicly funded services only, or if you're also looking at private-based ones, and also, what other nonprofit or community-based resources are available. So there's a lot of information gathering and a lot of understanding prior to actually engaging and finding community resources. This is just generally what I have found in my role as a caregiver coach, and in my role, supporting private family caregivers as well. So the other thing I was going to mention too, around when we're engaging with whether it's disease-specific organizations or nonprofit or the publicly funded system, that some of our best bets as we're starting, are social workers, case managers. Some organizations have actual patient navigators, occupational therapists, liaison nurses. Those are often individuals that can really help us understand the specific system that you and the care recipient are traveling through, and some of those kind of key resources and supports that you can access. Number 4 is this idea of ensuring that you have your ducks in a row. And by that, I mean, prior to calling any community resource or accessing a community support program, it's really good to have all of the necessary information in front of you with regards to the caregiver themselves and what their current status is, your own personal status as a family caregiver, but also the pragmatic pieces, like a power of attorney and a representation agreement, tax information, if that's applicable to that situation, around accessing either a income tested service or program, or a publicly funded service. Sometimes they need that information, in addition to maybe specific information from a specialist, with a diagnosis, So get all that ducks in a row is often really helpful prior to engaging or trying to access community resources. The other thing I just wanted to mention too is that that sometimes disease-based organizations have different supports for family caregivers. They have their own program, and so it's really important to know if that exists. And I also just want to highlight that Family Caregivers of British Columbia, that we have a number of different support groups and support options. There's virtual groups. We can help direct you to some community-specific caregiver support groups if they exist. Some caregivers really want to tap into our podcasts. In Victoria, we have a specific program for family caregivers. There's a walk and talk program. There's also our journaling workshops. So explore what types of supports exist in the community for yourself as a caregiver as well. And because we're talking very broad about community resources and how to access them, I would also direct you to, we have a resource page that has a heading that says Accessing Community Resources, and there are some really good written information about that. And then we also have a webinar that is around building your gold medal network. I think that's the actual term. And so those are probably, the best places to start around accessing community resources. And I hope that those tidbits of information will help you get prepared and become more informed as you reach out to different resources in the community. If you have any questions, or if you have any specific questions, I certainly urge you to call the Caregiver Support Line and speak to one of our amazing staff. And if you have any very specific questions, you can always send those over the email too, or you can send us a message and we'll be happy to respond to them to the best of our abilities. So thank you very much for joining me today. It's always a pleasure to be here monthly, and I'll be back in November. I can't quite believe that. Time is flying by. All right, sending you good wishes, positive vibes. Have a great week. Bye-bye.